Hello, everybody, and welcome to another one of our ultra popular and hopefully ultra helpful Fertility 101 episodes. Today, we're going to learn about egg donation, and we're going to do it with the help of an expert, Aisha Lewis, president of Everie, a known donor egg program. Before we dive into today's topic, I just want to take a second to remind you that we have some resources available for anyone who might want to bring fertility and family building benefits to their employer at progyny.com/talktohr. Most employers that offer family building benefits do so because an employee asked for it, so take advantage of our resources and help bring this life-changing benefit to your employer. Okay, let's dive in. As I said, Everie is a known donor program. So before we get any deeper, let's define what we're talking about when we say known donor.
Absolutely, because language here is interesting. Some people say open donation, some people say known donation. What we are asking of our donors is for them to be forward thinking about what they're doing in the egg donation process. And so they can choose to be known, which means they will meet the intended parents and exchange identifying information with the intended parents. Semi-known, which means they can meet the intended parents, but at that point in time of them meeting, they might not necessarily exchange identifying information and have an ongoing relationship. Or ID release, which means they agree at some point in the future that their identifying information will be given to the donor conceived when the donor conceived requests it. So they actually have a choice in all of that. And our donors are also given the choice in which IPs get to utilize their eggs. We have something called mutual matching, where the donors see a profile of the intended parents, as well as the IP seeing a profile of the donor. And we feel like this really lends transparency to the process and ultimately, really gets the buy-in from the donor, because egg donation is not a transaction, right? There's a lifelong implication of the donor having to give updated medical information about herself and her family, things that she will only learn as she ages, back to the donor conceived so they can manage their own health. And this buy-in really sets that foundation for this.
The most important thing to think about when thinking about open donors is a very practical one. Family health history is one of the first questions any doctor will ask when you see them for a checkup or a medical concern, and that's because we can get a lot of answers about our own health by looking at those we are genetically related to. And with a known donor, that information can be readily available.
Having a known donor means that you can have a relationship with the donor if you'd like. If there's questions that the donor conceived have and you have no idea of that answer, you can reach out to the donor and get that information. But the most important thing is access to updated medical information, stuff that we don't know because profiles are point-in-time transactions, right? A donor's going to learn things about herself and her family as she ages, and that information sharing needs to happen. And we feel it happens most organically in a known situation.
So, open donation is extremely important for the intended parents and the eventual offspring themselves, but it's important to point out that donors are also being thought of in this process.
It's important that the donor have the space to navigate her future. So we're very transparent with outcome information as well, so that she knows, okay, well, we know that somebody was born as a result of my donation in 2024. All right, heads up, family, right? We might have someone reach out to us at some point in time.
When seeking an egg donor, it's not unusual for intended parents, sometimes called IPs, to feel a bit overwhelmed, or to not even know where to start. Fortunately, support is baked into the process for anyone working with an organization like Everie.
Being connected with and thinking through what type of donation cycle an intended parent might want to utilize is a big decision. And so we can support in lots of ways. We can connect the intended parents to donor conceived communities so that they can hear those experiences and voices. We already connect them to psychologists and mental health professionals that can have them, think through what their needs might be. From the donor, same thing happens. They're already connected to mental health professionals, and we're building out, tools and resources for both the IPs and the donors to, access mental health professionals and get assistance when questions arise down in the future that they didn't think about at the beginning. So that's one big piece. And for the donor conceived, transparency. We want to really be transparent in getting this information. We want that to go back to the donor conceived. And I think probably the most important resource is we want to remain open to listening to the needs of the donor conceived community. They should have a seat at the table, and we should be listening to what their needs might be.
That right there was my favorite part of the interview. Often, and arguably too often, when we, as a community, an industry, and just people, talk about egg donation, we're really only talking about the donors and the intended parents. But, of course, there's a third party here that really must be at the forefront of everything. And that's what Aisha just referred to as the donor conceived. The babies, who grow to be children, and then teenagers, and then adults. The process needs to be done in such a way that they are considered, and future issues for them have been thought about, like the ability to access updated family medical records, as we discussed earlier. Now, let's get into the nitty-gritty. For intended parents who think they might need an egg donor, how do they get connected with an egg donor program?
Either their clinic will refer them to Everie, hopefully on that clinic referral list, or they can actually just reach out to us. Our website is everydonation.com. I don't know if there's an opportunity to put this somewhere on the podcast, but just that's a great starting point. We allow access to view our donors right away, and we are accessible and happy to talk about the process.
So, how are egg donors screened prior to donation?
I think it's important to know what the process is in screening the egg donor. Almost every egg donor has a pretty intense application process that they have to go through, right? So it's about a 2 to 3 hour application process. This is true for almost every donor program across the nation. We've got to gather a lot of facts. Once we get that information and the general criteria are met, like age, BMI, there's nothing really obvious that would rule the donor out in terms of the FDA, et cetera. We connect with the donor to, really have a one-on-one and answer questions. It's really important that the donor understands both the medical side of egg donation and the long-term obligations of being a donor. So we currently use a product called Engaged MD to really have the donor understand all that's going to be happening throughout the process. From there, we do some preliminary testing. Anti-Mullerian hormone, or AMH, is a big driver in the egg donor world. So we're checking the AMH levels of the donor, and we're getting her genetic carrier screening performed. And then finally, we have the donor meet with a genetic counselor. I say finally, it's not finally, before she moves on. We have them meet with a genetic counselor to collect 3 generations of the family medical history and to discuss what genetic carrier screening means for the donor and her own health. From there, if everything looks good, the donor meets with a psychologist and has a psychological assessment known as the PAI performed. And if that looks good, then we can continue on to the medical screening side of things, where we do what the physicians ask us to do in terms of their testing before they cycle the donor. That's the process.
And it's not only donors who are screened here. With Everie, intended parents fill out a profile as well.
I think when intended parents first hear that they're going to be creating a profile, they're a little trepidatious, right? They're like, wait, what if the donor says, no, I don't really want to share too much about myself? And that's totally understandable. What we say to them is, this is non-identifying information at this point in time. It can be as much or as little as you'd like. And even if all you want to say to the donor is why that profile resonated to you, it really helps the donor feel involved in the process, right? They can't see the warm fuzzies that the donors get when they receive these intended profiles, but I can tell you from experience, they feel so involved and so ready to help and support this family in any way that that family needs. So it seems scary at first when you get asked to complete an intended parent profile. Remember, it's just non-identifying information, as much or as little as you like, and it's cherished by the donor.
We've spent a lot of time talking about open and known donor, and how it's extremely important for the donor conceived to have access to updated medical history as they go through life. But after deciding to go with a known donor, there are still a lot of things to figure out.
The very first thing I say to prospective parents is figure out what kind of relationship, if any, you want to have with the donor. Start there, because that's going to narrow down the list. Like, if you know for sure that you want to meet the donor and exchange identifying information and maybe get updates every year, exchanging emails, that's a known donor situation. So, figure out what you're open to first. Then from there, you're looking at some certain things like values, physical traits that you were hoping to have. Genetic carrier compatibility is an important one as well.
Another thing to keep in mind is all of the legal considerations, and that's where agencies and programs like this can really help.
We do have attorneys on the North Star staff that have been very well versed in navigating, parentage issues with intended parents and donors throughout the United States. And so, donors, they do give up the rights of parentage when they're doing the donation. But for some groups, it might be still advantageous to have a legal agreement with the donor themselves. And so we're able to help, certain populations say, hey, I might live in a state that might not be very friendly to LGBTQ communities. Do I need to have a lawyer? Well, let's have a conversation with the attorneys to see if a legal agreement is going to add an extra measure of comfort and legality to the situation.
Intended parents need to also choose if they want to use fresh or frozen eggs. This is usually something that should definitely be discussed with your doctor.
I think for the most part, frozen donor eggs it's definitely the quickest, and it's the one that most Progyny patients utilize. And so if you choose your donor, then really probably within 3 to 4 weeks, the eggs could actually be delivered to your clinic. And it takes them, well, depending on what they're doing, probably another month to be able to prepare for the transfer. But for us, it can move pretty quickly. So, we collect the intended parent profile. We reach out to the clinic to make sure that they are comfortable moving forward with a specific donor based on her medical history and genetic compatibility. We offer the intended parents the opportunity at no cost to them to meet with a genetic counselor to understand the genetic risk between the donor and the sperm source, kind of putting those two together to kind of getting a baseline history for them and their pediatrician. And once we get approval, we go ahead and if it's known, then we do the meeting, right? And the legal agreements, same for semi-known, and then we ship.
The donor process can be intimidating, but with services like Everie, the process can actually be pretty smooth. There are a lot of choices to make, but fertility clinics and donor groups like this are highly experienced. That being said, for some, just the idea of donor can be a psychological hurdle. And for anyone in that camp, Aisha has some words of wisdom.
When someone just learns that they need egg donation, they're really looking at several different pathways to parenthood, or maybe even deciding to be child-free in the future. It's going to take some time to figure out what feels right to you. And then from there, do your research. There's a lot of different programs out there. Look at all of the various programs that might support what your needs are at the time, and try to be forward thinking. Try to think about what life is going to be like 5, 10, 15 years from now, and how you can support your child if they've got questions, because we really believe everyone has the right to know their origin.
So that's Egg Donation 101. And as you just heard, the process really can be a manageable one. Just remember that you have support, so ask questions. If you're already working with a fertility doctor, this is a place that they can really shine. If you're a Progyny member, don't forget that you can lean on your patient care advocate. And if you're working with an organization like Everie, well, this is what they do. So don't hesitate to communicate and make sure you're getting everything that you need. And with that, I want to thank Aisha for joining us today, and I also want to thank you for listening. If you want to connect with us, you can do so on Instagram at This Is Infertility Podcast. If you want to follow Progyny, you can do that at Progyny Inc. Of course, if you're listening on a podcast app, please leave a rating and review. This Is Infertility is brought to you by Progyny. This podcast is not intended to substitute for the personalized expert advice of your physician. I'm Dan Bulger, and this is Infertility.